Emergency healthcare in Ewutu Senya municipality is getting a major boost following the purchase of 2 ambulances by the Sanford World Clinic in Kasoa. The move seeks to either reduce or end preventable deaths recorded as a result of delayed emergency response. Many expectant mothers have died with their babies in their wombs due to delay in labor as a result of lack of ambulances to transport them to the hospital. Acting Municipal Director of the Health Service at Ewutu Senya, Dr. Sani Edu, shares the harrowing stories of some preventable deaths due to the absence of ambulances.
We have for now 1 polyclinic and about 24 CHIPS facilities. So the polyclinic is the only major facility that serves the people in this municipality. The polyclinic particularly does not have a theater service. That's until now we are trying to start blood transfusion services, and of course the emergency services are also not to its maximum, and its ambulance service has also broken down for some time. So for a long time we've been relying on the national ambulance services, which has 1 station here. Sometimes it's not operational. Sometimes when you need an ambulance, most ambulances serve in another place because it has to run between Winneba and other places. We at the polyclinic have quite an amount of referrals, especially emergency units and at the maternity units, mostly for emergency surgeries and other emergency care services. And many times people are referred, they have to go in ambulances, they have to go in private vehicles, in taxis, in another public vehicles. These are not improper for healthcare, and emergency health systems are time-based. And when you get the right emergency response with an ambulance care at the right time, we believe that we can save a lot of lives. It's frustrating. So I tell a story of one of our doctors who had to refer a woman who was been married for about 6 years without a child. She finally gets this pregnant, and she goes into labor, was in Kasoa, comes to a polyclinic. She's rightly assessed. We know that she needs a surgery immediately, and everybody's ready, but the ambulance is serving another place, and she has to be held up until the ambulance comes. And then when she gets into the theater table, finding at the referral points, the baby is lost. The doctors are depressed, the nurses are crying, the family is broken. It has a long-term consequences. Unfortunately, we've not been able to assess even the economic costs of such matters to our nation. So I believe that these are difficult. You need to get psychological counseling for health staff. Sometimes you lose the family to follow up, and we don't even know what's happening to the family emotionally and economically. So there are several more gruesome stories. The effect is big to the whole community and to the nation at large. So there are several more gruesome stories. Recently I went to the polyclinic, 2 road traffic accident cases. 1 has an ambulance, the other doesn't have an ambulance. 1 has a head injury, the other has internal bleeding. Who do you let to go into it? So as a medical practitioner, you go through a lot of stress dealing with all of these things, which could easily be solved if there was availability of enough ambulance services. So we believe that this is going to help all of these stresses.